Hello everyone, myself Dr. Sahil Patel, a consultant homeopath. So today we are going to discuss about sepsis condition. See, sepsis is a condition which comes under emergency where fastest treatment possible is to be given to the patient. And in this modern era, as we know that antibiotic course is given from the conventional mode of treatment, but there are many other systems which are also having a good great hold or the good scope in the cases of sepsis. So I'm going to discuss about some remedies from our homeopathic management as you can prescribe in your day-to-day practice lifestyles, and you can also observe these patients in day-to-day practice. So let us start with the sepsis. I am discussing these topics from Dr. Borland's Materia Medica book. His book's name is Homeopathy in Practice, and he has many different books on children's types, digestive drugs, for females especially, for respiratory system as influenza, pneumonia and all those conditions. So let us start with sepsis. So what is it? For an inflamed area where the heat is present, congestion is present and the swelling has started, what happens? The pain symptoms is started, and now the person has red streaks present on the inflamed region, and where the hot application aggravates the complaint. So you just have to think about a condition where inflammation has started. All the 5 points related with the inflammation have started, but aggravation by hot application leads to a single smaller remedy. Its name is Lidum Pal. Yes, my friends, this is very good remedy for the inflammatory condition where sepsis condition has just started. And the another second remedy for this condition, but the modality is different. If a person comes with similar inflammatory condition where hot, puffy, swelling is present, edematous condition has started, redness is seen, congestion can be felt by the patient, pain is increased, but the person says that by using hot applications his or her complaints get better. So amelioration is by hot applications. So what is the remedy? This remedy is Hepar sulf. Yes, you have to remember that Hepar sulf is one of the very good remedy. It is extremely chilly remedy, but helps in these conditions where hot application ameliorates the conditions. So these were the two remedies. Then another remedies are that, obviously, if you think about that, there are many remedies in this condition that you cannot even think about. Now next remedy which I am going to talk about has a symptom like when there is very severe stabbing type of pain. What is stabbing? If you use a knife to stab someone, that is called as stabbing. So stabbing type of pain which is very severe, where the person's mentality is most likely nervous excitement is felt by the patient. The best prescription in such conditions is the medicine named Tarantula cubensis. This is the remedy made from Tarantula species of spider. So you should definitely remember, this is the symptomatic treatment for such conditions in the septic conditions. Then the next remedy again comes from the animal kingdom, and that is where the infected area becomes dark purplish color and there is no sensitivity present at that site. Means insensitive site is there, and throbbing rather than stabbing pain. There is not something like a knife stabbing, but throbbing type of pain, which is something like pulsating pain which pulses around and pulses around. The next is the remedy which will be Lachesis. Lachesis can be given in such conditions. As you all know, we have think about that whenever necrosis condition happens, whenever gangrene conditions happen, what happens with the legs or the toes? There is a purplish or dark bluish appearance of those parts, and after that it becomes blackish. Why? Because it is literally dying because of the venous congestion, the blood supply is not present, and in such conditions or septic conditions Lachesis can be given. The next remedy is, in a I am going to discuss about Lachesis, that the whole part looks puffy and purplish or purplish blue, swollen, with a tendency for the infection to spread very rapidly. In the conditions of gangrene, this gangrene most likely develops very fast. So it is still present on the toe. You are thinking that no, it will take time, the person can take antibiotics for few weeks and it will be going on. But what happens that it suddenly starts developing. It is not only the dry gangrene present at the location, but what happens, dry along with the wet gangrene, both of them accumulate with each other, and so the infection is spreaded very rapidly. So Lachesis medicine can be given in such patients from our side. The next is where the condition is more advanced condition, where sloughing is seen. What sloughing means? The pussy discharge is there, where great offensiveness, smell is present, oozing of a quantity of blood or the dark blackish blood is present, which is always with pussy conditions means. So this condition is most likely the end stage of the septic condition where sloughing is present. So the third remedy from the animal kingdom which works really well in this condition is Crotalus horridus. Yes, my dear friends, it is also made up from the venom of a snake. Then next we go to pustular eruptions after septic infection. If a person has complaints that he or she had septicemia which was treated by some other means of treatment, and after that pustular acne or pustular any kind of boils, eruptions are presented on his or her body, then the next remedy which goes very well is calcarea sulf. Yes, calcium and sulfur. So this is not the Hepar sulf. You have to remember calcarea sulf for this condition. The next condition is there where character of pain is to be described. As we all discussed that hot applications aggravate, hot applications ameliorate. In such conditions which medicines are to be given, you have to distinguish them on the basis of that. Hepar sulf is to be given where hot applications ameliorate the patient's condition. And if you observe these patients where hot applications aggravate the conditions, we had discussed about Lidum pal. But the another remedy which is very useful in these conditions has the symptoms like swelling and tenderness, stabbing type of pain, shooting pain, stinging pain. The best prescription would be Apis mellifica. Yes, typical Apis mellifica manifestations are like there is severe swelling present, severe redness is present, and in these conditions Apis mellifica works very well. Even if you want to take these conditions from different area, if a person is having perianal fistula or perianal inflammatory conditions, in those conditions which may be mostly like from due to the B. coli bacterial infection, and the inflammation leads to fistulous tract which leads to the pussy discharge, oozing of the pus is present, so much of smell is present. One specific remedy for that condition is rust tox. So I was also confused regarding it, but rust tox really works very well in those conditions. So this was our topic about sepsis. It is an emergency condition. If your patient comes to you in a septic condition and fever and chills is completely present, the picture is septic, if you think that the toxicity is spreaded in his or her blood, you should think about the other mode of treatment also. Don't just blindly follow your system of medicine and make the patient's life something like risky life, right? So there is a last note in which Dr. Borland says that since the use of antibiotics, the very severe infections described by Dr. Borland as needing Lachesis or Crotalus horridus are rarely seen in the patients. If the correct homeopathic remedy is given in the early stages of an infection, majority will clear up without the need of any more drastic measures. See, this is the beauty of our homeopathic medicines. Even he on his time also thought about that the antibiotic treatments which are given to the patients will lead directly to the treatment of the patient, and Lachesis and Crotalus horridus condition will not be formed in those patients. But if a person comes to you with such a septic condition, then last measures of the treatment you can prescribe Crotalus horridus and Lachesis mutus remedy also. So this was topic of sepsis. So today I am also going to discuss about a bonus topic again with it, which is fainting and injuries to the eye region. So what is fainting? If you see some people that get something like faint away or get globus hystericus like conditions, they develop hysteria when they see just a drop of blood, or if they are present in a crowded room, or if they are present in a places where all of the people are something like depressed or sad people are present at that moment, a sad condition or the grief related condition is present. In these conditions, if a person faints, most likely females, most likely they will be leading towards the globus hystericus condition. There the medicine comes is ignatia amara. Yes, it is very good remedy for those conditions. If the faintness is due to the heat, overheating and stuffiness of the room, why the congestion of the room, then the remedy becomes pulsatilla. Why pulsatilla? Pulsatilla also resonates in his or her modalities, that the person gets better in open air. The person goes out of the room and his nasal congestion also goes away. Nasal congestion increases in the warm room, in the closed room. All these conditions are seen in those patients. If fainting is due to the shock, any kind of mental shock or any kind of acute physical shock, where extreme amount of blood loss is not present, where much more vital fluid loss is not present, in such conditions aconitum napellus also works well. So this was fainting condition. And the last thing is injuries to the eye, most likely the black eye. If you see that the people after getting uh, hurt on their head or any portion of the face, they develop the blackishness present around the eyes. A single remedy which works very well in this condition is Arnica montana. It is a short time injury. Because of the short time injury, the specific condition is known as black eye, where discoloration of deep purplish swelling is also present. So if the patient is after the injury comes to you and the discoloration and swelling is already present, then what happens? After much time, if the patient is coming to you after 2-3 days of time, then you can also prescribe lidum pal remedy for such condition. And if the injury is directly to the eyeball, if a baby's fist directly punches on the mother's eye, or the players are playing cricket and the ball directly gets hit to the eye, then the eyeball injury, then one very good remedy is symphytum. It works really well, better than the Arnica montana itself. So today we had discussed 3 topics. First one was sepsis, next is fainting, and the last one was injuries to the eye, the black eye condition. So kindly remember all those remedies and confirm that you comment down in the comment section the topics that you want to relate, the things that you want to get taught by me. And if you like my video, kindly share it with your homeopathic friends and colleagues. Thank you.